All right. Okay. I'm gonna log in under my screen here and hope for the best.
Hopefully yours goes a lot faster. Oh, because I was already in your custom.
All right. All right, for some reason it brought me right into Stephanie's note as myself.
Probably because that was the last note that was up. That's
Okay.
good to know, though. Because
That's good to know.
If you guys log out, that's awesome to know, because we were talking about that in Cairo the
Mm-hmm.
other day. So if you guys are on the desktop and you guys log out of your user, and then Christian comes in to finish up the visit, and he logs in, it'll pull up the last known note.
Mm-hmm.
So that's cool to know.
Right.
Thank you. One question.
All right. So I'm going to cover primarily how to enter in the acupuncture and the OM information. So how to actually do one of our treatment notes. And this system that I designed is actually pretty slick, and it is based off the 10 questions. And it's a very different charting model than you've been using in BackChart. There is some narrative when we enter in the history of the chief complaint, but the rest is going to be a lot of drop-down boxes, check boxes, or buttons that we select that will allow the note to expand or contract based on what your choices are. So we no longer have a note that is based on whether it's the initial visit or a follow-up visit. It's all going to be using the same format, but you'll be able to pick and choose which elements of that format are most appropriate for the patient you're seeing. We will ask, though, that all new patients to you, you will do the full assessment, which means you'll use all of the elements of the note. In order to create a new document, a new treatment note for your patient, I'm going to have you click on this button here called New Document. And which patient are you all in? Are you in the same patient, the Anderson? Nope, you're in different ones? Okay, good. So stay in the patient you're in. We're going to click on New Document. And you're going to see right here there's a button for Acupuncture Visit. So we're going to go ahead, highlight that, and click OK. And the screen's going to change. Everything on the left here is called a form. All of these 15 plus forms or so make up sections of the acupuncture treatment note. For all new assessments, all initial assessments, you're going to use every one of these forms, okay? And I'm going to guide you through each one to show you the functionality. We're going to be operating primarily on this side of the screen here, where we're going to be answering questions. And remember, this was designed to help you do the assessment and to diagnose appropriately. At any point, we can switch over to the text side by hitting this text button, and it will show us what we are actually filling in by selecting boxes or whatnot. So the first thing is we start out with some narrative, with some text boxes. And so we start with the chief complaint right here at the top. And this is designed to start at the top form and work your way down chronologically, just from top to bottom. So the patient presents today for an oriented medicine evaluation and services to address the following main complaints. Well, I think on this patient I assigned her low back pain. I think she might have had GERD too. And so we just have to list those. What are the primary things that we're focusing on that that patient wants us to address with TCM? Then we're going to go into the history of the main complaint. This is where you're going to discuss the initial onset, the severity, the location, the frequency, duration, what makes it better, what makes it worse. Okay, so that's where you can actually flesh it out through your narrative and using your descriptive language to describe each of those main complaints that you're treating. This part will actually probably be the lengthiest part of your narrative component of the note. Everything else will be pretty much more abbreviated. So this one's where you need to fully describe that patient's primary complaints. I'm going to have you select a severity scale. So maybe her low back pain is going to be a 6 out of 10. For follow-up patients, we're going to say, was there an improvement of the symptoms, no change, worsening of the symptoms, or not applicable? Well, this is the initial assessment, so that's not going to be applicable because there wasn't a previous visit. And then are there any additional symptoms that we want to mention? Finally, we're going to end with what are the patient's goals for today's treatment. So make sure that the patient's goals are in alignment with what we're actually treating, okay? Once I'm done to my satisfaction and your supervisors, your clinical faculty members' satisfaction with this component, we have a couple different ways to move to the next form. I can either click the button Next Form, I can click the arrow on the right-hand side, or I can select it right here. Now, in follow-up treatments, you only need to select the forms where information has changed that you want to address, okay? But for the initial evaluation, we're going to go through the whole thing. So I'm going to click just Next Form. Here now is where we can enter in the family history, hospitalizations, injuries, comorbidities, and that's going to be dependent on your patient's history. I'm going to move through that one and move to the very first TCM question, which is going to be sensations of cold and heat. So you're going to ask the patient, have they had a current or recent fever? And if so, I'm going to click this box, and you'll notice it'll open up other questions. Well, when did it start? What is their temperature? How long did it last? Did they also have chills with that? Was there alternating chills and fever? Was there tidal fever? Do they have aversion to heat? If I select current or recent chills, you're going to see the onset, temperature, and duration becomes visible. I have the option then to pick cold extremities, aversion to wind. And anything else that fits in that category that doesn't have a box, I can just go ahead and enter in and type in. And then move to the next form, which is going to be about sweating and perspiration. Do they have current or recent sweating? If I select yes, it's going to ask where? Anterior, posterior, axilla, extremities. Is there a certain time of the day? Do they have spontaneous sweating, etc.? Just for a moment, if I click on this text button again, you'll start to see that the information is now starting to be filled in here on the text side. So you can kind of double check and make sure that the system is transferring the information appropriately. I'm going to go to the next form, which is going to be about headaches, dizziness, and body aches. So have they had a current or recent headache? If I select yes, when was the onset? Is it due to injury or trauma? And where's the location of that headache? So I'll say a few days ago, no, frontal. The quality of the pain, maybe it's achy, maybe it's dull and there's pressure. I'm just going to rate it as an 8 out of 10. Any visual disturbances? Any other associated symptoms such as loss of consciousness, impaired speech, neck pain? And we're just going to move our way down there till we get to dizziness and vertigo, answer those questions, and very similar for body aches and pain. If I select yes, it's going to open up significantly more questions to answer. If I select no, it'll hide those again, which means we don't have to fill them out. And once again, an open text box in case this form doesn't quite capture what you want to say, you can always type it out. Keep in mind though, from a data standpoint, if we ever want to harvest some of the data for research purposes, anything you type in is not as easily accessed. Anything that has a checkbox, drop-down box, it's easy for the system to pull that and extrapolate information from that. Moving on to the chest, abdominal, rib side pain, if the patient has chest depression or chest pain, as you see, it's opening up other boxes based on how we answer these questions. This is also designed so that you can be doing this right in the room with the patient, because it doesn't take as much of your attention to sit and stare at the screen and type when you can just be pressing buttons. This is also designed to help prompt you as students to make sure you are moving through all the assessment questions. When we get to digestion, first question, is their appetite decreased, increased, or normal? Unusual food cravings, cravings for hot or cold beverages. Do they have recent nausea or recent vomiting? Unusual tastes in the mouth, and other relevant information. Bowel habits and urination. We start with urination. Frequency, quantity, color. Is there pain or discomfort? Is there an odor? Is there dribbling? Difficulty starting the flow? Enuresis or blood in the urine? And then moving on to the bowel movements. How often are they having a bowel movement? 1 to 2 times a day, 3 to 4 times a day, 5 plus, or less than once a day? Are they constipated? Is there diarrhea, blood or pus, or both in the stools? Then we're going to move into the hearing and visual acuity. Do they have diminished hearing? If so, what ear is affected? What's the severity? Was there trauma involved? Do they have tinnitus? Vision's very similar. Do they have ocular pain or discomfort? Redness or inflammation? Aversion to light or visual disturbances? And if they have visual disturbances, well, which eye is it in? Are there floaters? Is it flowery vision? Is it tunnel vision? Moving on to sleep patterns. How many hours of restful sleep do they have an evening? Do they wake feeling rested and refreshed? What are their energy levels during the day? How about fatigue? And what's the severity of that fatigue? Somnolence, Shen disturbance. And for Shen disturbance, we just ask you to describe it. We have an OBGYN form. So obviously you would not use this one for men's health issues. It starts with asking the regularity of their cycles. Is this early, normal, late, or intermittent? What's the length of flow in days, days between the menstrual cycles? What's the quality of the blood? Is there a presence of clotting, flooding and spotting, dysmenorrhea, discharge? And then we have the general miscellaneous information. So are there current stressors, lifestyle factors, work-related issues, personal issues that might need you to just describe them by typing them out, their emotional well-being, or anything else you didn't quite capture in your assessment, you could probably put under other information. That would probably be, we'd have to probably do that in another section. You know, we don't have a men's health form right now, but some feedback has been that perhaps we need to look at one, have one to include, so that information can be consolidated there. Now we're going to move on to some of the other aspects of the physical assessment, which is going to be our tongue and pulse. For pulse, we have this broken down to left wrist and right wrist, and then the three positions, the first, second, and third position. You can select a drop-down menu, depending on how detailed you want to be about the pulse. You can do all three or all six positions, or you can just choose the one that is the most applicable to your patient. So perhaps my patient has a floating pulse. Both sides, I just select floating in the first position. For tongue, body, coding, and other characteristics, we ask you just to type that out. There's too many adjectives that can be used to describe that. One thing you'll notice, though, is that particularly when we get to the pattern diagnosis, we're going to be asking you to use some standardized terminology, and that is by design. If when you get to the pulse positions, you don't find the quality that you want to use, find one of those 28 characteristics that is in that drop-down list, because those are the traditional pulse qualities, and find the one that is as closely matches the word you're trying to find, because we want everyone to be using the same diagnostic language, because right now there's some discrepancies around that. Next, I'm going to move to actually now, how do we select the actual pattern diagnosis? So you'll notice that in Chinese medicine, we have a couple different ways in which we can diagnose. One of the most common is what we call the organ or the Zongfu diagnosis. The first thing you need to do, and I'll preface this by saying you can have multiple patterns, you can have multiple diagnoses, but you have to select them one at a time. And the first thing that we do is we select how we want to diagnose. So let's say we're going to do a Zongfu diagnosis. I'm going to select that and then choose the appropriate meridian or channel pathway, and then select the diagnosis that is the most appropriate. So here we'll say spleen qi deficiency with damp. If I need to leave any comments about that, I can type that in here. Okay? But let's say, well, I want to add another diagnosis. This little red X means that we're currently working in this form here. If I click qi, blood, yin, yang, I can now say, here's blood. What if we do blood heat? And so on until you've achieved the type of diagnosis you're looking for. I can then also verify that over here in the text. Pattern diagnosis, spleen qi deficiency with damp, and blood heat. Once we have our diagnosis selected, we're going to move on to how are we actually treating that diagnosis. And the first thing we have is acupuncture points, because that is the most common therapy we use. You'll notice that there are tabs up here and a little arrow to move from side to side, or there's buttons down here. They will bring you to the same place. All you need to do is simply select the acupuncture point you used, and whether or not you did, so we're in lung right now, so if I did lung 7, I would select 7 if it was bilateral, or I could choose left or right. And then I would simply move through until I have chosen all the points that I feel is appropriate for that patient. Simply selecting the points that are needed until I've completed how I've actually treated that patient. Any questions about up to this point? Pretty straightforward, pretty intuitive and easy? All right. So next thing I'm going to do now is move to the next actual clinical form, which is somewhere around here. I'm actually going to just click on the right arrow here. And this brings us to the extra points. So here you could select which extra point you used, or points. If you do eStim, we ask you to use this little tab right here, and I select if no electrical stimulation was used, or if it was, the location means what 2 points were they connected between, what was the frequency you chose, the duration, the wavelength, and the intensity. Okay? If you do acupressure, we ask you to select the acupressure points now in the same way as the acupuncture points. And they're organized the same way, except the extra points are not listed, so those you could just list here in the additional information tab. Now we have a whole host of accessory techniques that we can use, and those are all listed here under 2 tabs in order to get them to fit. Starting with auricular acupuncture. So if you do auricular acupuncture, choose the ear, and then choose the actual points that you did. Okay? How about cupping, ear seeds, tuina, intradermals? Oops. Herbal therapy, you can go ahead and enter it here. So let's say I'm going to give this patient Gui Pi Tong. Dosage and frequency. So I'm going to say 8 pills 3 times a day. Heat therapy, dermal friction, dietary therapy, etc. Once I'm done with that, I'm going to move to the final form, which is the plan of care. I'm going to select this box so it includes that text. I'm going to make recommendations for how many treatments per week, for how long those treatments should take place. So I'm going to say 8 to 10 weeks. A reevaluation will take place after 10 weeks. When should they return to the clinic? I'm going to say 5 to 7 days. Is there additional information and other patient instructions? Okay. Now, I want you to keep in mind the herbal prescription we prescribe because I'm actually going to show you how to send that prescription to the dispensary. There will be no more running back and forth, no more filling out prescription pads, etc. So that will make a lot of our dispensary assistants happy. But before we get to that, I want you to notice these 3 buttons up here: orders, medications, and problems. If during the assessment the patient says, oh, and by the way, I also have migraines, well, you assess that, but you didn't add it into their patient desktop under their problem list, so you can actually access that right here and add a new problem in. So we'll say migraines. And that will add it to the front of their charts. Okay? For orders, the orders are something that you really haven't had to use in back charts because they didn't really have a good functionality for it. But this, in clinical practice, this is how we get paid if we're billing insurance. This is where we assign the codes for acupuncture as to what we're treating, and that will then go to the billing department, whether you're a student working in the student clinic or in the BNCC. And what we just need to do is simply click order. If you need to add a problem, like during your assessment, so if you held the chart maintenance, the clinical list changes before you got into the document, it's not going to allow you to add a new problem until you close out that one and then reopen it, because anytime you change that list, it's going to open up your chart maintenance again as its own independent thing. So you can actually see sometimes in one patient's chart, there might be 7 chart maintenances for one visit if you keep going back to that front screen altering those. But you can only alter it at one time, then you have to close it or end it, then open it up again.
So what they could do right now is if everybody selected end on this note and hit hold document.
So for this note, if you go ahead and hit end, and for the interns, you're going to hold the document. Supervisors will end up signing off on the document.
We're just going to hold it so then they can get back to the up here. So if they have the chart maintenance that says edit.
So I don't have this in my box, but some of you might have, here it says office visit with an asterisk. That's the one we were just working on. If any of you have one that says chart maintenance, you can go ahead and stay in that box and you can edit it. No. Just go ahead and hit end.
Here?
Yep. There should be a little end button next to it. Mine says edit. Nope, that was right.
Okay. It just isn't doing anything.
Oh, because you were hitting cancel. So then you can hit sign document. And you either have to sign the document or hold it. If you sign it, it'll close out in that chart maintenance. And you have to hit OK. Anytime you hit save and continue, all it does is thinks that you want to press something different next. OK is what actually closes it out. And you should just hit OK through those text boxes. Make sure you read them. And if you have more than one open, more than one chart maintenance open for some reason, you're going to have to close each one or hold each one. Once you do that, you can go ahead and add a new problem. And once you add a new problem, it's going to open up that chart maintenance again. And then you'll have to edit and end that chart maintenance, which is separate from the office visit buttons, okay? Remember, chart maintenance is just when you're altering these 5 boxes. The office visit is the document, the treatment note that we're actually working on. Once you've done that, go back in and edit your office visit document, which should bring you back to your note. It'll bring you back to the top of the note, so back to the main complaint. And now I'm going to have you click on orders. First thing that we want to do for orders is go down to this custom list screen here and select use the acupuncture codes. And here are all the different codes that you're going to see that we can use to bill towards. If you're in UHS, you're going to do student acupuncture. If you are in the other clinics, you're going to be using either the acupuncture without stimulation, 15 minutes, additional, et cetera, et cetera. But what we need to do is tell the system what we're actually using the acupuncture for. So I'm going to go ahead and I'm going to pull all these over in the potential diagnoses. I'm going to pull them over. Oh, well, let me do it one at a time, I think. Because all of our charts will be connected with all the other providers, there might be lots of problems listed here that are being addressed by the massage therapist, the physical therapist who will be starting soon, the chiropractors. If we were managing this patient's GERD, but not their lower back pain, not their migraine, then I'm only going to select GERD, and I'm going to want to pull it over somehow, and it won't let me. Oops. Oh, there we go. I'm going to select the acupuncture without stimulation. If I didn't do e-stim, going to pull GERD over, and now I'm basically telling the clinical system that I'm treating just the patient's GERD with acupuncture. These other issues might be getting treated by massage or by chiropractor. If I am treating all of these issues, then I'm simply going to pull them over too and assign them to that procedural code. Because I did that for 30 minutes, I'm going to give it 2 units because each unit is about 15 minutes for acupuncture. And then I'm just going to sign those orders. All right. Once that's done, I'm going to end this note. And me, because I'm the supervisor, I'm going to go ahead and I'm going to sign it. You want to make sure that your supervisor that's routed to your supervisor So for me, I can only route it to me because I'm the supervisor. But you, in the live version, will be able to route it to your supervisor. And I'm going to sign the document. You can choose to sign it or hold it right now. In the live version, you'll only be able to hold it, and your supervisor will sign off on it. It'll get routed to their desktop. They'll look at it before the end of your shift, and they'll sign it. Any questions about that? Kimmy. Stephanie can probably grab that one. Once you're all able to end that document, you want to make sure that here, where it says chart, that you have nothing left open that you can edit or end. So anything that you have right there, edit or end those so you can tell the system you're done with those. And then I'd like to show you how to do herbal prescriptions. If you want to see the document you just completed, we can go under Documents. And here, where it says Office Visit by me, I'm going to go ahead and make this larger with this little button here. This is the note we just created together. Okay? Stephanie, she had something. Does everyone have everything ended or closed under their charts? Pardon me? No, because you'll only be able to hold it.
Well, I can't get rid of this. How do I get rid of that then?
Hit edit. That's the office visit. And try end on the right.
Yeah, I've been doing it. It won't let me. I can't do this. I can't do this.
Oh, no, so if you hold it, it's going to stay open until your supervisor signs off on it.
So,
So it'll just hit hold.
yeah. But
And that's okay.
so that's okay.
Yep. Because until they sign it, it's still
I mean,
able to be
move on
edited.
with this, it's okay.
Yep. So you could actually be working on another patient and go back and say, oh, this is still open. I just remembered I also did Twain, but I didn't document you. So you could actually go back and you can alter it until it's formally signed by the supervisor. So yeah, so as interns, you'll be able to edit it until the supervisor signs it.
That's,
Get you out of the system.
I couldn't open it, and she came over and said, you have to sign it. So, I don't
Well,
know.
that was probably your clinical list changes or the chart maintenance.
Okay.
Because this is the confusing part, is the type of where we're entering in information. So this right now is just the treatment note. But anytime you start altering something outside that treatment note, that's going to be the clinical list changes or the chart maintenance. Those you have to kind of close out. Because you're the one making alterations to the medications, you need to say, I finished that, I did that. And that's different than the treatment note.
Well, it was the treatment note. I couldn't open.
Can you open it now?
Well, yeah, but I signed off on it.
No, here, it's still open. So click at it.
Oh, well, that's not.
That's the treatment note.
I don't know what's going on.
Yep, that's your treatment note. So if you hit end,
Was it- I had the same thing. I don't know.
and if you hit hold document, it's going to keep it here until your supervisor signs it. So right now, the system will route it to your supervisor.
I think I just had it opened as something else. 'Cause- okay.
Can you open another new document? And do acupuncture again. So there you go. So now you actually have two new documents open. And if you hit end, you could just actually choose to discard it because it's a duplicate. So it might have been, and then this is back to the original one that we're working on. Yeah.
So if I did the order,
Mm-hmm.
and then that's the diagnosis,
Mm-hmm.
I press OK.
Oh, hit sign.
It's not responding. Double click?
That's unusual. Maybe try canceling.
It's not working.
Oh, I wonder if it's your terminal then.
So if this happens, then what do you do?
Call IT.
Or maybe close it off?
I'd say, yeah, maybe close it all out and then so see if you can close out of Centricity altogether
Okay. So basically.
and then log back in.
So this one, the chart, when you do edit to the patient's, acupuncture chart, it goes that. And then the chart desktop, which will shows the maintenance.
Right. Right.
Which
Well, the
will show
chart,
this one.
chart desktop is your desktop, so just you. So for
Okay.
all your patients you're working with. Chart is one patient's chart.
Okay, so you can select which patient from that.
Right, yeah.
Where do you go for the chart maintenance?
Well, the chart maintenance is only while you're in a certain patient's chart.
Uh-huh.
So go to chart desktop if it lets you.
No, it won't.
See if you might have to close out or kind of control out, delete out of it and re-log in.
So, but like, would this be in the file? I'm sorry. I'm trying all this, but if I signed it, how do you delete it?
Well, if you sign it, you can't delete it.
But then this patient,
As
she
long
was
as
telling us,
as long as you don't sign it, you can discard it. But when you get to the button, so here, if you hit end, it'll pull up the screen that says sign, hold, and over here it'll say discard. So if you discard it, will get rid of the whole note.
okay,
Like, oops, I accidentally didn't mean to open that note. But once you sign it as a supervisor, you can't edit it anymore. It's locked.
so then, like, we're playing with this, so we maybe mess up with the patient's file then? If, someone accidentally put sign off?
Right. But the students won't be able to sign off. It'll only be the supervisors. And then you'll have to go in, and you can always open up a new note and just leave a note, like saying, signed
Alert
early,
alert.
or you could do alerts. But as long as it's attached to the patient's chart.
Okay.
So, yeah. Her terminal's frozen.
Which one?
This one. Yeah, she can't get. I'd say try Control Alt Delete and see if just.
It doesn't work on the desktop, I know.
Oh.
Mine froze up already.
Okay. So are we all back to the desktop for the most part? Okay. Because I wanna go ahead and show you how to enter in an herbal prescription that will actually route it directly to the dispensary. And this is actually pretty slick. This took us a while to figure out how to get this in a way that it would communicate with the dispensary and would minimize paperwork and running back and forth and all of that. So the best way to do this is going into medications and clicking add. And one thing you need to be mindful of now is we have what are called 3 different TCM custom lists. And I'm going to start with the easiest and then move through the more complicated, okay? So what we do is we find the custom list here. I'm going to go ahead and pull it down and go down to the bottom where it says TCM herbs, ready-mades, and topicals. So these are your T pills. I'm going to click on that. I'm then going to choose the formula. Now I believe in the other part of this chart I said choose on Gui Pitong. So everything that's in here we entered in based on our dispensary's inventory. So if it's in here, we should be able to prescribe it out of our dispensary. So this list is specific to our dispensary. It's not just all the Chinese formulas, it's what we have. So I'm going to go down and I'm going to find Gui Pitong, or I could type it in. Under instructions, this is where I would give the dosage instructions. So I'm going to say 6 to 8 pills 3 times a day. I'm going to select the category of non-drug. Oh, okay. Under comments, if I need to communicate anything to the actual dispensary, to the dispensary assistant, I would do it in here. Remember, it will be part of the patient's description, so keep it professional. Keep it related to the prescription. If the patient has some special need with that formula, you could put it here. The duration, I'm going to say 7 days or 1 week. For the pharmacy, I'm going to hit select. I'm going to go to the E and select Edith Davis Dispensary. I'm then going to, here under prescribing method, make sure it says print, then fax to the pharmacy. I'm going to click OK. And right now it is generating a prescription and sending it internally to the dispensary. Okay? So that was for something simple like our T-pills. So we have another option. So let's go to medications again. Click on the plus sign in medication. This time I'm going to scroll down and I'm going to just choose TCM formula. These are all of our powdered formulas. So here, maybe I will pick Bujang Ichitang. Okay? Instructions. Here I might say 3 grams 3 times a day with warm water. Under comments, I might say modify, add 6 grams, not grams, grams of whatever herb you'd like to add, okay? And then same as below, select the pharmacy, Edith Davis, and I'm going to click OK. Now, let's say we have to build a formula from scratch. Here I'm going to click on the plus sign again. This time in the dropdown, I'm just going to select Herbal Custom. And here, under the comments, I am going to say whether it's raw herbs or powdered herbs. And I am now just going to start building that formula using plus sign. So add 6 grams of Huang Qi, add 6 grams of Ren Shen. So whatever I want, however I want to build that formula, I'm going to do it here. It's under comments. Comments. Instructions is still dosage instructions for patients. So I might say 4 grams twice a day. I'm going to do it for 1 week. And I'm going to go ahead and click OK. If at any point it asks you to do a cover page for the fax, the pharmacy has asked that you do not add a cover page to the fax. Because the way the system is doing is it's printing out a cover page, a blank page, and then the prescription, so 3 pieces of paper for 1 prescription when we've been testing it. So if ever given the option in the system, and it sometimes does that, select no cover page, okay? Now what you will notice though is that these formulas haven't been actually sent yet because they haven't been signed off on. So you can enter in the formula, but it won't go to the dispensary until your supervisor signs it for you in the system. So this is where you could send them a note, a little alert saying, please review prescription. Or you could just grab them and say, hey, Barbara, could you please sign off on, Regan Anderson's formula or make alterations to it. Once you do that, once you need to sign it, I can simply highlight it, click the, backtrack just a second here. This is the sign button right here. You notice it's grayed out. Anyone want to guess why it's grayed out? Because I'm doing chart maintenance on medications, I have to tell the system I'm done editing the medications. And then it will sign off on the medications for me, theoretically. Yes. So those have been signed off on now. And you'll notice I'm done editing the chart. Now, these herbal formulas will stay on there, and it will assume that the patient is taking the formulas until you tell the system that the patient is no longer taking that formula. So let's say next week, the patient comes back in, and we're going to continue with Gui Pi Wan, but I'm going to take her off the Buzhang Yi Qi Wan. I'm going to go ahead and right-click and tell it to stop. It's going to say why, and I'm going to say, well, the regimen was completed, or maybe the patient preference, maybe there were side effects, maybe it wasn't effective. I'm going to choose regimen completed. Click OK, and you'll now notice it disappeared. Now it disappeared, but it's not gone. So if you wanted to see historically all the prescriptions they've been on, I need to tell this to show me them. So right now it's only showing me what they are actively taking. So if I select the drop down and say, but everything, it'll then show me in gray that at one point they were on Buzhang Yi Qi Wan, and then they were removed from it. And it's grayed out, meaning they're no longer on it, and the dark formulas are the ones that they are still currently taking. If I go back to just active only, it'll just show me the current active medications. Any questions about how to formulate a prescription? Any questions about the TCM notes or the documentation process? Because I edited the medications, the system now says, oh, I'm doing chart maintenance again. So I need to go back and I have to edit that and make sure I'm done with it. Once I don't have anything in here that's being held for my supervisor, once they sign off on it, it won't be held anymore. Then you're done with your charting for that patient. Okay? So I know it's a much more complex and complicated system than we're used to, but I think this gives us much more opportunity for data collection. It'll eventually, I think for many people, will move more smoothly and efficiently while you're actually in the room with the patients, selecting things, not having to type out everything. You'll be able to chart a lot faster once you kind of get a feel for everything. What I would say is if at any point you're not able to progress further in a patient's chart or the notes, see if any of the chart maintenance is open and you need to still close out on that before you can hold your note in your office visit notes, your document notes, okay? One thing that Stephanie had mentioned under her chart that wasn't available, but I have on mine, is this is the scheduling system. So on mine, I do have schedule. I think 1 and 2 are, I don't know actually what the 1 and 2 represent, if those are rooms or if those would be intern slots. Or if you double book, which sometimes happens. You'll be able to, your supervisor's schedule will be here, and you'll be able to move through the dates to look at various dates. Yep. And much like in Backchart, you could also then just select the patient on the schedule and open up their chart. So any questions before we finish up? The remote desktop, which is how you access Centricity, is on all these computers. It'll be on the computers in the clinics. It's on the computers in the library computer lab, and it will be on the computers in 209, 15, and 211. You are free to play with us before we go live. This is the practice version. So you can't access it from home, but you can access it from various places on campus. I would say if the computer lab's open, come in and just play around. There will be refresher courses once we get closer to July. But this is kind of the basic intro to the training. But I think there will be drop-in classes going forward. So once you've already done your initial training, there will then be times available for you to come in, meet with one of the super users, and just kind of troubleshoot over things or kind of refresh your memory on how to work with this. The first several weeks of clinic, there will be super user and IT access in clinics to help with the charting process, because we know it's very different than what we're accustomed to. But I think it'll start working pretty smoothly once we get a few weeks in. There are some Saturday sessions of training also available that are just general sessions. You can feel free to come sign up for those. I think we are kind of encouraging people, try not to sign up for a second session until we've moved through everyone in the program that needs to be trained, just make sure there's enough seats available. But there will be, like I said, more training sessions going forward. If you do have issues with access, that's going to be Bill, who was in here earlier. Bill Johnson, his email is wrjohnson@nwhealth.edu. He's the centricity specialist. We call him Super Bill. So for all issues centricity, he is the guy, including how to log in, access, or technical issues too. And he knows the system pretty well also, so if you have questions about, well, how do I do this in the chart? He won't be able to really answer most questions about acupuncture, but how to enter the information, he'll know. Yeah.
So for herbal prescriptions, we're no longer using the pad once this happens.
Right.
So
Yep. Yep, it'll all be in here.